Welcome everyone. I'm so excited that you all could join us today. Welcome to the first ever Arch Respite Research Summit. My name is Jill Kagan and I am the director of the Arch National Respite Network and Resource Center. Arch is a national resource center that has been providing training and technical assistance to respite providers, to government agencies, to state respite coalitions, state and local advocates, as well as family caregivers for nearly 3 decades now. We've been working all this time to make sure that family caregivers who are caring for anyone of any age and any condition have access to high quality respite options in their local communities. In 2009, we were funded by the Administration for Community Living to house the Lifespan Respite Technical Assistance and Resource Center. Specifically to support Lifespan Respite grantees and their partners. For those of you who are not familiar with the federal Lifespan Respite program, the goals of that program are to help states build statewide coordinated systems of respite services for all family caregivers, to build respite capacity through gap filling measures and through training and recruitment of respite providers and volunteers, and to improve respite quality and responsiveness. In 2013, we began our work to advance the evidence base for respite by helping to promote respite research and have been engaged in this work since then. At that time, we convened an expert panel on respite research that formulated a research agenda that we've been working on implementing for the last several years, and you'll be hearing a lot more about this from Ray Kirk with Arch in a few minutes. Prior to today, you should have received a participant packet or a link to the participant packet that includes the program agenda for the next 2 days, speaker bios, and discussion guides that we'll use tomorrow in our roundtable discussions. If you can't get your hands on your email right now to download that packet, you can still access it as well as our speakers' PowerPoint presentations from the link that you see at the bottom of your screen right now. And we'll post that link, or it may already have been posted in the chat so that you can access it anytime during the day. The event is also being recorded and we'll make the video available to everyone in the next couple of weeks. Next slide, please. We wanted to get a better sense of who is participating today, so we'd be very grateful if you take just a minute to respond to this first poll question. It really looks like we have fairly broad representation from across lots of different disciplines. But I'm also very excited to share with you that our participants hail from across the United States, representing 33 states and the District of Columbia. I want to welcome our international friends as well from Canada, India, England, Ireland, Scotland, Wales, and South Africa. So thank you all for your interest in this event and in these issues, and for helping to make this a truly global event. Next slide, please. I especially, of course, want to thank our supporters without whom the summit could not take place. The John A. Hartford Foundation, longtime champions for family caregiving, the Wareheim Foundation, and of course, the Administration for Community Living, which has supported Arch for more than a decade now. Next slide, please. We also had a fantastic planning team, and I want to thank them all for the countless hours they put in to bring this event together and doing it all with such good cheer. Dr. Ray Kirk with Arch, who also served as facilitator of the original expert panel on respite research. Dr. Kim Whitmore with the University of Wisconsin-Madison School of Nursing, a respite researcher in her own right, and she'll be serving as our summit facilitator for the next 2 days. Dr. Susan Janko Summers and Cassandra Furman with Arch. And special thanks to our note takers, Alita Embry, Jane McCoy, Natalie Leek Nelson, and Monica Ewell. And of course, special thanks to our technology support, Marcia O'Malley with Mindful Media Services and Adam Todd with Zoom. Next slide, please. To help provide context for the next 2 days, I just briefly wanted to share with you the purpose for convening the summit. Our first summit objective is to provide an overview of the current status of respite and related research. And to help with this effort, ARCH just released, we conducted a literature review and released an updated annotated bibliography that we shared in your packets. So I hope you had a chance to look at that. Again, if you haven't, you can download it from the Summit webpage. The second objective is to highlight respite and promising practice-based research with reference to the ARCH expert panel research framework. The third objective is to review the progress we've all made in implementing the expert panel 6 recommendations. And the recommendations are written in tiny little print on that key icon. You can find a more readable form also of the recommendations in your packet. And you will be seeing this key icon a lot in others' presentations over the next 2 days. And then finally, the last objective is to identify gaps and barriers to respite research, the translation of research into practice, and the steps forward to address these. Next slide, please. We don't expect that our work in this arena will end with this summit. The summit may be the culmination of the work of the expert panel on respite research, but it's also a kickoff of the next phase of this important work. ARCH was fortunate enough to receive a new cooperative agreement from ACL that will provide the support to enable us to continue to promote research that examines exactly how to improve access to and quality of respite services, and also identifies best practices, especially as we're working harder than ever to reach diverse groups of family caregivers. Today, we're announcing the formation of the Committee for the Advancement of Respite Research. Many of the committee members will be presenting or participating in this summit, and you have a list of those committee members in your packet. So thanks to all of you who have so generously agreed to serve in this capacity. In addition to advising ARCH on promoting an evidence base for respite, we're going to really look to this new committee to help us identify methods for assessing the impact of new and alternative respite options that have been creatively launched during the pandemic, when more formal respite services have become largely unavailable. And this is going to be a critical part of the work that the committee does as we work to redefine respite in light of COVID-19. Next slide, please. As you can see, we've got a packed agenda the next 2 days. Again, you can find the full program in your packet. Following this welcome session, Ray Kirk will provide a quick overview and background of the expert panel's deliberations, and that'll be followed by Kim Whitmore, challenging us to keep an equity and diversity lens on all our work going forward. The first panel will share their own work in promoting research agendas that we believe fully align with ARCH's goals. We believe totally in collaboration and strengthening our collective voices. We'll then take a short break at 2:45 to give you a chance to stand up and move around, get a cup of coffee, and we'll return to a very exciting second half of the agenda. Next slide. Following the break, we'll hear from a prestigious panel of researchers who will reflect on current research, provide new findings, very exciting new findings from promising interventions, and address challenges in accessing respite that still exist for many families. And we'll conclude with a panel of respondents today, 2 of whom served on the original expert panel on respite research, Sue Peshin with the Alliance for Aging Research, Dr. Corey Robinson-Rosenberg with the University of Colorado School of Medicine. And we're also glad to have Dr. Joe Caldwell, who has served in multiple advisory capacities to Arch for many years and is now, fortunately for all of us, a member of ACL's Ray's Family Caregiving Advisory Council. They will respond to, at the end of the day, to what we've learned so far and offer their thoughts on next steps. And I hope at that time that you will also provide, all of you who are participating and attending, provide your input at this time as well. Unfortunately, Lori Stelbaum, who's the current federal project officer for the Lifespan Respite Care Program, couldn't be with us today, but we're so pleased to welcome Greg Link, Director of the Office of Supportive and Caregiver Services at the Administration for Community Living. We have been extremely privileged to have worked with Greg, who served as the Lifespan Respite Federal Project Officer for the TA Center for many of our early years, and helped formulate a lot of our work, especially in this research arena. I'm welcoming now to offer a few words, Greg, so please take the floor.
Well, thank you, Jill, and thank you for having me. I do send greetings from Lori Stahlbaum, who had to take the day off today. But I do want to welcome the summit participants, both here domestically and around the world. It is really exciting to see the interest that this work is generating. Back in 2012, when ACL issued the funding opportunity announcement for the second iteration of the Lifespan Respite Resource Center, we included this look at what we can do to advance the field of respite. So much of what ACL has done in the past 10 to 15 years has focused so much on advancing or establishing the evidence base for certain types of home and community-based services, whether it is in chronic disease self-management programs, falls prevention, dementia support services for family caregivers of people with dementia, that it only seemed logical that we begin to look at how do we advance what we know about the most effective forms of respite? How can we make the best use of very limited respite funds? And we know that tying our work to science is the best way that we can do this. I am so pleased to see the agenda today. The advancements that have been made since Jill and her colleagues have embarked on this work is truly remarkable, and I look forward to sitting in on as much of this conversation as I possibly can. And this conversation that we're having today around respite research and where we go with it in the future is so critical. As Jill mentioned, ACL has for the past little over a year now been implementing the requirements of the RAISE Act. And one of those requirements will be the development and implementation of a national caregiving strategy. A big focus of that caregiving strategy will be a look at how we better provide respite services across the country. And I believe that research will play a critical role in how we begin to rethink and better shape the respite services that are available out there. So I want to just say thank you to Jill, send my greetings to Rani Snyder at the John A. Hartford Foundation. I love working with you all. I am really excited for today's meeting. I'm going to sit in on as much of it as I possibly can. But with that, Jill, I'm going to turn it back to you. Thank you.
Thank you so much, Greg. We love working with you too, and thank you for being here. It is with deep gratitude now that I welcome Rani Snyder, who is the Vice President Program at the John A. Hartford Foundation, to offer some remarks. Thank you so much again for joining us, Rani. It has been a pleasure and an honor to work with you, and I look forward to all of our future collaboration.
Thank you, Jill, and thank you, Greg, also for those lovely comments. We have some fantastic partnerships, so I'm really honored to be here. Many thanks to Jill and Kim and the rest of the team, and that includes Adam in IT, because those IT guys get left out sometimes, and you know they're making this all work for us. There's a lot of uncertainty right now, but there is one thing we know. Due to the COVID-19 crisis, caregivers are doing more now, doing more caregiving than ever before, and they're doing it without access too frequently to respite or other support programs. And we really need better access to those high quality respite opportunities. And that's what the research will lead us to. So more than ever, caregivers are socially isolated. They need the respite services. And these need to be ready really before this crisis occurs, right? So that they can be in place when needed. Next slide, please. So just a few words about the John A. Hartford Foundation. So our foundation is a private philanthropy. We are based in New York, and we were established by the family owners, John and George Hartford, of the A&P grocery store chain in 1929. So our program on aging and health began in 1982, and since that time, the foundation has funded over $625 million in grants to improve aging and health. We've spent most of those funds first building the field of aging experts, and that started with medicine and nursing and social work, and then also testing and replicating innovation. So to this last bullet, we have a history of funding the scale and spread of evidence-based programs, and that's what we're talking about here with regard to respite. Next slide, please. So our mission is to improve the care of older adults. We know that respite is a service that goes beyond any specific age, but at the foundation, our focus is on older people. And we have 3 different program areas that we use as our approach to improving care for older people. So building age-friendly health systems, supporting family caregivers, and improving serious illness and end of life. And you can see, not just from this visual, but you would just know to think of it, that these are 3 mutually reinforcing programs, and there's a fair amount of overlap. So we could put respite services in any of those 3 areas. For us, they feel most central to the family caregiving area. Respite services are integral. I'm not telling you anything you don't already know. They're integral to providing family caregivers who are so critically important to our families, our communities, and the healthcare system, with time to care for their own well-being and their own mental health. Next slide, please. So this just shows, this is a visual of some of our grants in our family caregiving portfolio. There are a whole host of ways and settings in which respite may be needed. And one of the things that we think about, and I want to note, is the particular difficulties involved in dementia caregiving, which is an area that we pay a lot of attention to. So one strategy for providing supports for family caregivers of individuals with dementia, for example, would be to provide adult day programs and respite in the evenings. And this is particularly popular because individuals suffering from dementia often have sundowners syndrome, in which they flip awareness, for example, of their days and their nights, and they may even become more hostile in the evenings, thereby making it more difficult for caregivers to rest. Next slide. I'm going to talk a little bit about some of the grants that we have made in our family caregiving area, and talk a little bit about the specific ways that respite interplays. So as part of our work, the John A. Hartford Foundation supported a National Academy's report called Families Caring for an Aging America. That came out in 2016. And this report was really, from our perspective, we wanted to use it as our guide to funding in family caregiving. We wanted to make sure to make the recommendations of this report come alive by following up with our funding. So the report said, among other things, that the focus needs to be not just on person-centered care, but on person and family-centered care. It also suggested that supportive family caregivers needs to be an integral part of the nation's responsibility for caring for older adults. And it had 4 recommendations. There's a section of this report that is specific to respite. And in that segment, the report says, research is further needed to determine the added value of respite-type services to existing evidence-based programs for family caregivers. So there it is. This is just one of the statements that reflect what you all already know. And then that section of the report ended with, the long-term benefits to respite to caregivers have not yet been demonstrated. That's exactly what we're here to discuss. Research takes time. And so it takes the time to build that research. The work that Arch has been doing is just getting started around the time that this report came out. And this is really why we need your minds, we need your work, we need your research. And I'll share a little bit in just the next few slides, some of the work that we funded and a couple of respite related elements. Next slide, please. So one of the grants that we've funded is to the Center for Healthcare Strategies, and it is titled Helping States Support Family Caregivers Who Are Caring for an Aging America. That comes right back to that report I just mentioned. This work supports scale and spread of family caregiver supports in 6 different states: New Hampshire, South Carolina, Alabama, Idaho, Virginia, and Iowa. And Alabama specifically had a goal that was dedicated completely to respite care. Their goal has been to increase respite care access by establishing statewide worker standards and strengthening workforce capacity. These are the kinds of things that we need in a whole host of ways. And to do that, they developed a funding plan for an academic pilot program for respite care training at an Alabama community college. These are the kinds of things we want to study. Next slide, please. Now, Greg mentioned this work already. We also supported a grant to the National Academy for State Health Policy to work together with Greg and his team at ACL around the creation of a family caregiver resource and dissemination center that is specific to supporting the work of the RAISE Act and their advisory council. So as part of this work, we funded listening sessions with key groups of stakeholders. This is the work I do with Greg on a weekly basis in terms of talking about discussing these amazing things that we're learning. And on a recent session with states, so these are state aging and disability leaders, they were polled and they were asked about caregiving services that are provided by the states. And we learned that, among other things, 93% of states said that they provide access to respite services for caregivers. That was the highest percentage of any service. And that's compared to the next highest was 83% that provide family caregiver support programs. And the next highest was not nearly so high at 60%, providing a family caregiver website and information. So that 93% who are providing access to respite services need to understand the best practices for those services. So there's a lot to be learned. Next slide, please. To some comments that Jill made, we also have supported the Diverse Elders Coalition for a grant entitled Addressing Unmet Family Caregiving Needs in Diverse Older Communities. This is really, really important, and we want to make sure that we are paying sufficient attention and being as inclusive as possible when we think about family caregivers broadly. And these are some of the things that this training curriculum is covering: educating and training practitioners, health and social service agency leadership, and frontline workers, providing evidence-based information, resources, and support to caregivers and diverse older adults, and educating national and local policymakers. And I would really like to be able to end at add at the end of that last bullet, in the need for respite services for family caregivers. We need the evidence. So the examples I've cited on the last few slides were mainly state specific, but there are other ways that the federal government could add flexibility to improve respite, and there are a whole host of examples of that. These ideas and others are really worth exploring, and what we need is your research, your experience, to come up with creative solutions and to help us make the case. Because ultimately, we all want the same thing: to support the caregivers who are the linchpins of care in our communities and our families. So I really want to thank you again. Next slide. That's my sign off. I'm just so pleased to be here and can't wait to learn from all of you over the next 2 days.
Thank you so much, Rani. I can't tell you how heartening it is to have a foundation that's so attuned to the needs of family caregivers and willing to support initiatives to move forward. And we really look forward to collaborating with you some more in the future. So thank you again for being here.